Imagine you're sitting in your doctor's office and you hear the words, "If we had caught the cancer earlier, we could have helped you." That moment, full of regret, could become your reality if you miss the important signals your body is sending. Every day, hundreds of families around the world face tragedies that could have been prevented if they knew what to look out for. Stomach cancer is called the silent killer for a reason. Its symptoms often go unnoticed until it's too late. But here's the good news. You can change the outcome if you know what to look for in the early stages. Hello, my name is Dr. Ethan Hale. Today, I'll talk to you about 8 early signs of stomach cancer, spotting which could save your life. These symptoms are so subtle that they can easily be mistaken for something minor. But if you catch them early, you can get checked and prevent the disease from progressing. Watch this video to the end, because in the second part, I'll share important preventative measures that can help you protect yourself and your loved ones. The information you're about to get could be the key to preserving your health. Ready to learn more? Then hit that like button, subscribe to the channel, and let's get started. Before we dive into the specific signs, it's important to understand what stomach cancer is. The better you understand the nature of this disease, the more likely you'll be able to recognize it early and take the necessary steps. Stomach cancer is a malignant tumor that develops from the cells lining the stomach. In the early stages, the disease may not show obvious symptoms, which is why it's often called the silent killer. The tumor can grow slowly, gradually spreading into deeper layers of the stomach and affecting other organs. But what causes this disease to develop? There can be many reasons, from genetic predisposition to unhealthy habits and poor diet. Understanding this helps us realize how crucial it is to pay attention to even the slightest changes in our body. Now that we have a better understanding of what stomach cancer is, let's move on to the next step. It's important to know what signals our body might be sending in the early stages of the disease. In the next part of the video, we'll look at 8 early signs of stomach cancer, spotting which could save your life. Let's talk about something called early satiety, which might seem like a minor issue at first, but could actually be a concerning sign. This is a symptom that many people overlook, blaming it on stress or poor diet. Early satiety is when you feel full after eating only a small amount of food. It can show up as a feeling of fullness in your stomach, or even mild nausea after eating. At first, this might seem insignificant, especially in today's world where many people are cutting portion sizes to control their weight. However, if it's happening regularly and without any obvious cause, it's something to take seriously. Why is this important? The thing is, in the early stages, stomach cancer can develop almost without symptoms. One of the first signs of the disease can be early satiety. As the tumor grows, it reduces the stomach's capacity or interferes with its normal function, which causes this sensation. As a result, a person may start losing weight, not getting enough nutrients, and their overall health begins to decline. Besides stomach cancer, early satiety can also be linked to other digestive issues like gastritis or ulcers. However, the key difference is that with cancer, this condition comes with other symptoms, which we'll talk about later. If you're experiencing this regularly, it's definitely not something to ignore. Have you noticed anything like this in yourself? I'd appreciate it if you shared your experience in the comments. If you have any questions, or if something seems unclear, ask away. Let's figure it out together. The next symptom we'll talk about today is anemia and fatigue. Let's dive into how these common signs can indicate the onset and progression of cancer. Anemia is a condition where the hemoglobin level in the blood drops, leading to insufficient oxygen supply to the body's tissues. At first, this might seem like just a result of iron or vitamin deficiency in your diet. However, if anemia develops without any clear cause, that's a red flag. In the case of stomach cancer, anemia can be caused by chronic internal bleeding from the tumor. This bleeding is usually unnoticed because it happens slowly and covertly, but over time it leads to iron deficiency in the body. Symptoms of anemia include weakness, pale skin, dizziness, a rapid heartbeat, and shortness of breath, even with minimal physical activity. You should especially be concerned if you experience chronic fatigue that doesn't go away even after plenty of rest. This fatigue can be so intense that it starts affecting your daily life, making everyday tasks harder to manage. When it comes to stomach cancer, Fatigue can also be caused by disruptions in digestion and nutrient absorption. The tumor can interfere with the normal digestion of food, leading to a lack of essential vitamins, minerals, and energy. Have you noticed anything like this in yourself or your loved ones? Don't hesitate to ask questions because together we can find the answers. Let's move on to another warning sign that often goes unnoticed: persistent nausea and vomiting. These symptoms can be linked to many different conditions, but if they're persistent and unexplained, they definitely deserve your attention. Nausea and vomiting can happen for many reasons, from a simple food poisoning to more serious digestive issues. However, if these symptoms become constant and get worse over time, it could be a sign of a tumor in the stomach. The tumor can block the normal movement of food through the digestive tract, causing discomfort and leading to vomiting. Patients often start noticing that the episodes of nausea happen without any clear cause, regardless of the time of day or the type of food they eat. This kind of nausea can come with a heavy feeling in the stomach, a sense of fullness and burping, which adds to the discomfort and worsens quality of life. In some cases, vomiting may contain traces of blood, which points to damage to the stomach lining. Nausea and vomiting can also be a result of the general toxic effect of the tumor on the body, disrupting the function of internal organs and leading to overall malaise. If you or your loved ones are experiencing these symptoms for an extended period, it's important to see a doctor for an examination. Early detection of these signs can play a crucial role in diagnosis and successful treatment. Have you ever experienced any of these symptoms? Share your thoughts and questions in the comments, and you won't be left without attention. Now let's talk about the next early sign: stomach pain and bloating. These symptoms can be quite common and at first might not seem serious, but their persistence and progression definitely require careful attention. Stomach pain is often one of the first signs that something isn't right in your body. It's important to note that the nature of this pain can vary, from dull, constant discomfort to sharp, sudden attacks. In the case of stomach cancer, the pain is usually constant, getting worse over time and not easing with typical remedies. Bloating that comes with the pain is also often ignored because it can be linked to common digestive issues, like eating heavy food. However, if bloating becomes regular and is accompanied by pain, it could point to more serious problems. Pain and bloating can also be accompanied by other symptoms like heartburn, burping, and a burning sensation in the stomach area. These signs are often brushed off as stress or bad eating habits, but if they become chronic, it's time to see a doctor. How do you deal with stomach pain and bloating? Share your experience, and maybe you'll help someone else pay attention to their body's important signals. Now let's move on to the next warning sign: unintended weight loss. This is one of the most obvious signs that something serious might be happening in your body. Unintended weight loss is when you lose body mass without any obvious reasons, like dieting or increased physical activity. If someone notices they're losing weight without trying, it could be a cause for concern. In the case of stomach cancer, this weight loss is often due to disrupted digestion and nutrient absorption caused by the tumor. As stomach cancer progresses, the tumor can interfere with the normal functioning of the stomach, reducing food intake and slowing down digestion. This leads to the body not getting enough nutrients to maintain a healthy weight. On top of that, cancer can also cause changes in metabolism, which further contributes to weight loss. Loss of appetite is another factor connected to unintended weight loss. Patients with stomach cancer often notice that their appetite decreases, eating is no longer enjoyable, and mealtime becomes burdensome. When combined with a constant feeling of fullness or discomfort after eating, this leads to a significant decrease in calorie intake. Sometimes, weight loss can be accompanied by general weakness and fatigue, which makes daily life even more challenging. People can feel drained even after minimal physical activity, which only worsens the situation. This symptom is an important signal that your body needs help. If you or your loved ones notice weight loss without an obvious cause, and it's accompanied by other symptoms like stomach pain, nausea, or fatigue, it's crucial to see a doctor without delay. Now let's talk about the presence of blood in stool or vomit. This is one of the most alarming signs, and it requires immediate medical attention. Blood and stool or vomit can be caused by a variety of things, but in the context of stomach cancer, it's often linked to damage to the stomach or intestinal lining caused by the tumor. These damages can lead to bleeding, which may appear either in vomit or in your stool. The blood can be bright red or dark, almost black, depending on where the bleeding is coming from. When blood appears in vomit, it may look like coffee grounds. This is because the blood is partially digested in the stomach before being expelled. Blood and stool can come in various shades, from dark red to black. The dark color, known as melena, usually indicates that the bleeding is coming from the upper parts of the digestive tract, such as the stomach. Bright red blood and stool, on the other hand, may point to issues in the lower parts of the intestine, though stomach cancer should still be considered. In some cases, the bleeding may be minor and not immediately noticeable. However, even small and infrequent occurrences of blood and stool or vomit should raise concern. Over time, such bleeding can lead to anemia, which we discussed earlier, as well as overall deterioration of your health. Why is this symptom so dangerous? The thing is, it could be a sign that the disease is progressing. This can lead to serious complications, such as shock or even stomach perforation. That's why doctors recommend not waiting and seeking professional help as soon as you notice any signs of blood in your stool or vomit. Please share in the comments if you've ever experienced these symptoms or heard about similar cases from people you know. Continuing our discussion of the signs of stomach cancer, let's move on to another important symptom: swollen lymph nodes. After discussing bleeding, it's important to pay attention to changes in the lymphatic system, which plays a key role in our body by helping fight infections and draining excess fluid. However, with serious diseases like stomach cancer, lymph nodes can become an indicator that something concerning is happening in the body. Lymph nodes are part of the immune system, and when they swell, it often indicates an infection or inflammation. In the case of stomach cancer, enlarged lymph nodes can be linked to the cancer spreading beyond the stomach. Most commonly, this affects the nodes near the stomach, but sometimes those in other areas of the body, like the neck or armpits, can enlarge as well. Swollen lymph nodes in stomach cancer can be detected either by a doctor during an examination or by the patient themselves. They may be painless or cause discomfort, especially if they become significantly larger. Patients often notice swelling in the neck, collarbones, or groin, as these nodes are close to the surface of the skin and are easy to feel. It's important to understand that swollen lymph nodes aren't always a sign of cancer. They can enlarge for other reasons, such as a bacterial or viral infection. However, if the swelling is accompanied by other symptoms, like weight loss, fatigue, or changes in stomach function, it's a serious reason to see a doctor for a more detailed examination. Diagnosis of lymph node involvement in stomach cancer typically includes a physical exam, ultrasound, and biopsy. The latter helps to precisely determine the nature of the tumor and its malignancy. The earlier metastases in the lymph nodes are detected, the higher the chances of successful treatment. Let's now discuss another alarming sign that often accompanies stomach cancer: persistent heartburn. For many people, heartburn is an unpleasant but fairly common occurrence that happens after eating something spicy, fried, or too fatty. However, when heartburn becomes frequent and persistent, it could be a sign of more serious issues, including stomach cancer. Heartburn is a burning sensation in the chest or throat that occurs when stomach acid rises into the esophagus. Normally, the stomach is protected from its own acid by a special lining, but in various conditions, including stomach cancer, this protective mechanism can be compromised. In stomach cancer, there may be an increase in stomach acidity or even the development of an ulcer, which causes stomach acid to irritate the stomach and esophageal lining. In the case of stomach cancer, persistent heartburn may occur for several reasons. For instance, the cancer could interfere with the normal functioning of the sphincter. This is the valve that regulates the movement of food and liquid from the stomach into the esophagus. Because of this, acid can flow into the esophagus, causing heartburn. Also, the tumor may hinder proper digestion, which can lead to food being delayed in the stomach and excessive acid production. People suffering from this symptom often experience discomfort and a feeling of acidity in the throat, which disrupts normal sleep and reduces quality of life. It's important to remember that while heartburn can be associated with minor problems like gastritis or reflux, if it persists for a long time or worsens, it should be a reason to see a doctor. It's especially dangerous to ignore persistent heartburn if it is accompanied by other symptoms like weight loss, bleeding, or stomach pain. These signs could indicate that the condition is progressing, and stomach cancer has affected not just the stomach lining, but other organs as well. Diagnosis of heartburn potentially linked to cancer usually starts with an endoscopic examination. During a gastroscopy, the doctor can see changes in the stomach lining and, if necessary, perform a biopsy to determine the presence of cancer cells. If you are experiencing persistent heartburn, don't delay seeing a doctor. It may not only be a symptom of gastroesophageal reflux disease, but also an important signal of potential stomach issues, including cancer. Now that we've discussed the 8 early signs of stomach cancer, let's move on to one of the most important sections, which is about cancer prevention. As we have already discussed, stomach cancer is a cunning disease that often doesn't show symptoms in its early stages, and many people seek help only after the disease has progressed. However, there are several preventive measures that can help minimize the risk of stomach cancer and maintain good health for many years. One of the most important aspects of stomach cancer prevention is proper nutrition. The foods we eat play a huge role in the health of our stomach and digestive system. A diet rich in fresh vegetables, fruits, and fiber can help reduce the risk of many diseases, including cancer. Foods that contain antioxidants, such as berries, leafy greens, nuts, and legumes, are particularly beneficial. These foods help neutralize free radicals and reduce inflammation, which in turn lowers the risk of tumor formation in the body. It's very important to limit the consumption of processed foods, red meat, and foods that contain carcinogenic substances such as fried meats, smoked foods, and canned goods. Consuming too much fatty food also increases the risk of stomach cancer, as it can lead to digestive problems and inflammatory processes in the stomach. Experts recommend maintaining a balanced diet that not only helps maintain normal weight, but also promotes the proper functioning of the gastrointestinal tract. Another important step in preventing stomach cancer is quitting smoking and limiting alcohol consumption. Smoking is one of the leading risk factors, as it can not only damage the stomach lining, but also cause chronic inflammation, which contributes to the development of cancerous cells. Alcohol, in turn, also has a harmful effect on the stomach, destroying its lining and increasing the likelihood of ulcers and gastritis. Equally important is regular medical checkups, especially if there have been cases of stomach cancer or other cancers in your family. Undergoing regular gastroscopies or other diagnostic methods can help detect diseases at an early stage when treatment is still effective. Also, remember that maintaining a healthy weight and an active lifestyle contributes to reducing the risk of cancer. Physical activity helps improve metabolism, strengthen the immune system, and reduce inflammation in the body. Studies show that people who lead an active lifestyle are less likely to suffer from stomach diseases, including cancer. What do you think about these preventive measures? Perhaps you have your own tips and recommendations on how to easily quit smoking or alcohol. I'd love to discuss this with you in the comments. And now we've reached the end of our video. We've covered 8 early signs of stomach cancer and discussed how important it is not to miss the moment and seek medical help in time. I've also shared important preventive measures that will help you stay healthy and active for many years. Remember, your health is in your hands, and paying timely attention to your body is already a huge step towards longevity. If you have any questions or thoughts on the video topic, feel free to write them in the comments. I'm always happy to chat with you and help with any questions related to prevention and treatment of diseases. It's important to me that you get the most useful information, so I will try to respond to each of you. I hope this video was helpful to you and provided the necessary information. And if you're interested in another important topic, click the link on the screen and watch the new useful video, which will also help you maintain your health for many years. I wish you health and happiness. Take care of yourselves, and see you next time.